Welcome back to In Focus, and it is time now for our In Focus Health Report. Health reporter Linord Moudou joins us now to tell us about World Health Day coming up on Saturday. Hi, Linord.
Hello, Demi. World Health Day is celebrated each year on April 7th. The day marks the anniversary of the founding of the World Health Organization in 1948. It is a global campaign inviting everyone to focus on a single health challenge with global impact. The topic of World Health Day in 2012 is aging and health, with the theme Good Health Adds Life to Years. The focus pinpoints how good health throughout life can help older men and women lead full life and productive life and be a resource for their families and communities. The World Health Organization says the number of people today aged 60 and over has doubled since 1980. To discuss aging and health, we are joined in the studio by Bethany Brown, Policy Director of the organization HelpAge USA, an organization dedicated to provide care, support, and advocate for the rights of the elderly. Ms. Brown, welcome to the show.
Thank you.
Also joining us on the phone from Geneva, Switzerland, is Dr. John Beard, Director of the World Health Organization Department for Aging and Life Course. Dr. Beard, welcome to the show.
Thank you.
Let me start with you, Dr. Beard. Why is it important to focus on aging this year?
Well, the world is rapidly aging, and it might surprise many people to know that it's actually now low and middle income countries which are aging the fastest. If you read the papers, you'd think that was a problem. In fact, we think it's something to celebrate. We think older people are a wonderful resource for their families and their communities, but the key is to make sure that they can retain their health. And so we're trying to focus attention on that and trying to get governments to take some action.
Okay, and Ms. Brown, your organization, HelpAge USA, focuses on the well-being of the elderly. What do you see as on the ground as the challenges of the elderly?
Being able to enable older people to live their lives unhindered by disability and life-threatening conditions. Their health helps their lives, helps the lives of the people that they care for, helps them to be able to participate in economies and communities with independence for as long as possible.
Dr. Beard, now tell us about some of the challenges that older people go through, especially in low and middle income countries, like in sub-Saharan Africa, for example.
Well, actually, it's interesting because we've just reanalyzed some data, and what we found was that the biggest causes of death and disability, wherever you live, it doesn't matter whether it's a rich country or a poor country, are non-communicable diseases. And the biggest killers are heart disease, stroke, and chronic respiratory disease. And the biggest causes of disability are visual impairment, hearing impairment, and dementia. Now, almost all of those can be prevented. And the really shocking thing was that when we looked at low-income countries compared to high-income countries, the burden of those diseases was 3, maybe even 4 times higher in low-income countries than it is in the rich world.
And that will be because of lack of resources or awareness? What would you say?
Well, it's due to a lot of things. There's a number of risk factors, which diet and the lives people have lived, but also it's due to lack of access to basic health care.
Okay. Ms. Brown, tell us about some of the programs that your organization have put in place to address these issues, especially non-communicable diseases. Dr. Beard just mentioned that as being one important issue.
Medical approaches and interventions to non-communicable disease are absolutely necessary, and they offer great opportunity to make sure that older people are living healthier lives. But that doesn't tell the whole story, because some of the things that he mentioned are things that have to do with nutrition. They have to do with family structures and education and literacy. And these sorts of approaches are things that can be done regardless of the amount of medical training that's available, particularly in rural areas. We have programs that work on improving access to healthy food through agricultural programs. We have mobile health clinics that provide basic health services, primary health services, as well as cataract surgeries, which is obviously a very important part of maintaining sight and the ability to be active in daily life.
Dr. Bird, what would you say in a general sense that are the basic steps that people can take to reach an old age at the best possible health?
Well, the best thing is to start as early as you can, in fact, even before you're born, because nutrition is important and that continues throughout life. People shouldn't smoke, they should only drink in moderation, and they should remain physically active all through their lives. These are things we all know, but as we live longer and longer, it's a bit like a car. The longer you have a car, the more servicing you have to give it, and we need to think about our own bodies in that way. Also, we need to, particularly as we get older, make sure that we're screened for non-communicable disease, and if we have some of the risk factors like hypertension or diabetes, make sure that those things are adequately managed. And we also need to make sure that governments create the sort of physical and social environment around us that allow older people to continue to contribute and participate. And finally, the rest of us need to rethink what it means to be old anyway, and we need to stop stereotyping older people in ways that marginalize them.
Now, what would you say is the official age to be considered old? This may sound like a simple question, but at what age is somebody considered officially old?
You know, I get asked that a lot, and I try and avoid the question because I'm the director of the Department of Aging, and we called it that because what we're trying to emphasize is that we're all aging. Aging from the moment you're born. And there's no one day at midnight when you wake up the next day and you're suddenly old. When we use data, we have to use a cutoff, and we use 60. But as many people in developed countries know, 60 is not old. But in places in Africa, it certainly is these days. And what we want to do is change that so everybody can experience the same sort of quality end-of-life years that they do in some parts of the West.
Okay, Ms. Brown, on the ground, what do you see in terms of the difference with regards to the elderly in the rural area and in the cities? Do you see a difference with their needs?
The needs of older people remain the same wherever they are. Their access to screening and treatment that Dr. Beard mentioned is something that they do not have the same access to. People living in rural areas of sub-Saharan Africa make up 63% of the population of that area. Those people don't have the same access to finding out whether they have hypertension. 80% of older people in South Africa have hypertension. 10% of those people are getting the treatment that they need.
Very interesting. And quickly, Dr. Beard, I'm going to end with you. In the global brief for the World Health Day highlights 4 key actions that governments and society can take now for healthier and more active aging. Can you summarize them for us?
Yes, we need to foster healthy behaviours across life. So health promotion, we need to provide basic primary health care so we can have screening for things like hypertension and diabetes and manage them better. But we also need to remember that some people, regardless of how much prevention we do, will develop the consequences of chronic disease and lose the capacity to be independent, and they will need some sort of long-term care.
Great. Okay, Dr. Beard, thank you so much for joining us.
It's a pleasure.
And thanks to both of our guests, Bethany Brown, Policy Director of the organization HelpAge USA, and Dr. John Beard, Director of the World Health Organization, Department for Aging and Life Course, for joining us today.